بسم الله الحمد لله والصلاة والسلام على رسول الله صلى الله عليه وآله وصحبه وسلم. This is our third lecture, the pharmacy practice course, second semester. Inshallah, we'll continue talking about responding to symptoms, how you as the community pharmacist will respond well to the customer or patient symptoms. We will continue on respiratory system. Today, inshallah, we'll discuss the cough. Coughing is a protective reflex action that caused when the airway is being irritated or obstructed. The purpose of the cough is to clear the airway so that breathing can continue normally. The majority of coughs presenting in the community pharmacy will be caused by a viral upper respiratory tract infection. They will often be associated with other symptoms of cough. This is the majority of the symptoms that presenting or representing cough that coming to a community pharmacy is usually associated with a cough. However, we will see also there is some of the serious conditions or serious illness that also may be associated with cough. So that one of the rules or responsibilities for you at the community pharmacist is to distinguish between the cough that arise from a minor element so that you will respond with giving OTC cough medication or the other conditions that associated with a serious condition so that you will respond by referring the patient to the physician. Cough is a symptom of many conditions, as we mentioned, most of which require referring to a doctor for further investigation. The pharmacist must be able to distinguish between a cough from a minor condition and one from potentially more serious cause and make appropriate referrals. Many coughs are self-limiting and will be better within a few days with or without treatment, especially that arise from upper respiratory tract viral infections. What you need to know, you should know to respond well for the patient or customer that coming to you suffering from a cough. You should know the following: the age, is it a baby, child, adult, the duration of the symptoms, the nature of the cough, is it dry or productive, the association of other symptoms, and you should know also these associated symptoms such as cold, sore throat, fever, sputum production. Is there any chest pain? Is there any shortness of breath, wheezing? Because wheezing directly indicate asthma, because wheezing is a characteristic clinical feature for asthma. Previous history, you should know the previous history of the patient. Is there any chronic bronchitis, asthma, diabetes, heart disease, gastroesophageal reflux? Because also gastroesophageal reflux is one of the causative or one of the causative disease that occurs or associated with cough. Smoking habit. You know that smoking, chronic smoking is one of the causative factor or causative factors that lead to coughing. Also, you should know the present medication is a cough that arise from present medication, patient medication, such as the famous angiotensin converting enzyme inhibitors, which are associated with a dry cough, or sometimes beta blocker also can cause cough as a side effects. Some of the non-steroid anti-inflammatory drugs also can cause the cough. This is beside that you should know the present medication, because this can influence your choice if there is a possibility of a drug interaction, such as that we mentioned in symptomatic drugs, because many of these cough remedies or cough syrups contains symptomatic in their ingredients. First, the age. Patient age, is it a child or adult, will influence the choice of treatment and further will affect your decision in to refer the patient or not, so that it can affect whether referral is necessary or not. Children will most likely to be suffering from an upper respiratory tract infection, and this is facilitate or facilitate the differential diagnosis of the cause of the cough presenting to you in the community pharmacy. Recurrent cough in children with a family history of eczema, asthma, or hay fever. This can, if there is a recurrent cough in a children with a family history of eczema, this can indicate this patient may develop or developing an asthma attack. So to take the patient history, if he especially if he suffer from a recurrent cough, this is also a site or position for referral. This might suggest asthma, and referral would be required for further investigation. Adult patients with persistent cough might have chronic bronchitis and emphysema. Both of them are chronic obstructive pulmonary disease, especially if they are smokers. You should know also the total duration of the cough symptoms. If the duration is about 3 days, this may indicate upper respiratory tract infection. The duration about 3 months, about 3 weeks, sorry. This is indicate acute or chronic bronchitis. If the cough duration is longer than 3 weeks, this can indicate serious pathology. So also referral should be is an appropriate choice or appropriate advice to refer the patient. Duration for 3 months indicate chronic bronchitis or tuberculosis or carcinoma. You should remember that some drugs can cause cough, as we mentioned, such as angiotensin converting enzyme inhibitors and non-steroid anti-inflammatory drugs and the beta blockers. In general, a cough of longer than 2 weeks duration that is not improving should be referred to the doctor for further investigation. Take this as guidelines. Cough duration longer than 2 weeks, although that the patient taking a cough syrup or cough remedies, it's better to refer the patient for further investigation. A cough that is worse in the morning suggests postnasal dripping or chronic bronchitis. If the patient comes to you suffering from or indicating that there is a worseness of the cough, especially in the morning, this may suggest postnasal dripping or chronic bronchitis. And we know postnasal dripping we talked about in the previous section. You should also know the nature of the cough. Is it dry, unproductive cough, in which there is no sputum produced? This cough is usually caused by viral infection and are self-limiting. Productive cough, in which sputum is normally produced, it is caused due to over-secretion of sputum that leads to coughing. This over-secretion may be caused by irritation of the airways due to infection, allergy, or so on, or when the cilia are not working properly. This is truly caused or truly happened in smokers. The cilia are not working properly due to the irritation that caused by smoking. Non-colored, this is the nature of the sputum. If the sputum is not colored, that is mean clear or whitish sputum, indicate uninfected, and this type of sputum is called mucoid. Colored sputum, green, yellow, or reddish colored, reddish brown colored, This may sometimes indicate a bacterial chest infection such as bronchitis or pneumonia, and this is if the patient if the patient declared that he have this colored sputum, you should directly refer this patient because he may need further investigation and indication maybe of antibiotics. Sometimes the bloody sputum may be present. This is called hemoptysis, pink or deep red due to the color of the blood. This blood may be an indication of a relatively minor problem, such as the breast capillary flowing about of a violent coughing during an acute infection, or maybe warning of more serious problem. Hemoptysis may be due to the minor condition اللي هي تنتج من البروست اللي هي الانفجار او التمزق بتاع السمول كابيلاريز نتيجه للفيولنت كافينج, and this is a minor problem and maybe also indicating a serious problem such as maybe sometimes in tuberculosis also the sputum may be hemoptysis, that means bloody sputum. Hemoptysis is an indication of referral. Anyway, if there is the patient declared that he has bloody sputum, hemoptysis, this is a condition that require a referral. Chronic cough with hemoptysis associated with chronic fever and night sweats are classical symptoms of tuberculosis. This is a classical symptoms of tuberculosis. Hemoptysis with night sweatings and fever, chronic fever. This is classical symptoms of tuberculosis. We have a whooping cough or peristosis. The characteristic whooping is not present in the early stages of infection. The whoop is the sound produced when the breathing is after a paroxysm of coughing, and this is require referral. whooping coughing اللي هي السعال الديكي عندنا هنا بنقول له كده. هو إذا كان اللي عنده characteristic this pattern of coughing or type of coughing, this is necessarily should be referred. The associated symptoms with cough such as cold or sore throat or catarrh اللي هي runny nose or over secretions of the nasal secretions may be associated with cough. Often there may be a temperature and generalized muscle aches present. This would be in keeping with the viral infection and be self-limiting, such as اللي هي symptoms that associated with the common colds. Chest pain, shortness of breath or wheezing are all indication for referral. The patient mentioned that he has a chest pain with the cough or shortness of breath or wheezing, because this may indicate asthma, as we mentioned, especially wheezing and shortness of breath, dyspnea. This is situation that require referral. You should know also the previous history of the patient. Certain cough remedies are best avoided in diabetic patient and anyone with heart disease or hypertension. Coughing can be a symptom of heart failure. If there is a history of heart disease, especially with the persisting cough, then referral is advisable. Patients with a family history of eczema, hay fever, and asthma appear to be more prone to extended episodes of coughing following a simple upper respiratory tract infection. And it said that allergies such as eczema or dermatitis are often developed in the same people, and about 50 to 70% of the children with atopic dermatitis subsequently develop asthma. So that if the patient, if you take the history and you find that he have suffered from dermatitis or eczema or even hay fever, it is better to refer this patient because he may be uh, developing an asthma attack. Gastroesophageal reflex can cause coughing also, and smoking will exacerbate a cough and can cause coughing since it is irritating the lungs, because smoking irritate the lungs, so that can cause coughing. And even if the patient has a cough, then the smoking will exacerbate the smoking will exacerbate the cough. So here, this is you can take this chance to advise the patient if he to cessate or to cessate اللي هو smoking cessation. This is a better side to have an advice for the patient to cessate the smoking. You should know also the present medication. It's always essential to establish which medicines are currently being taken by the patient. This include both prescribed and OTC drugs. It's important to remember the possibility of interaction with cough medicines. We talk already about this because many of these cough remedies contain sympasomimetics, so that sympasomimic, we know that in have interaction with drugs. We talk about this in the previous lecture. It is also useful to know which cough medicines have been tried already, because the pharmacist may decide that an inappropriate preparation has been taken. For example, a cough suppressant for a productive cough. انت اذا هو still جاك ان هو suffering from الكف وindicate ذاته ان هو although that he taking a cough syrup but still he suffering from this coughing, you should ask him what cough remedies have been used by this patient. You may find that this patient given cough suppressant although in this patient have a productive cough, and vice versa. If one or more appropriate remedies have been tried for an appropriate length of time without success, then referral is advisable. لكن إذا لقيت إنه هو أخذ العلاج المناسب, if he taken the suitable medication for the certain cough and there is no response, you should refer this patient. Chronic coughing may occur in patients, particularly women, taking angiotensin-converting enzymes such as enalapril, captopril, lisinopril, and ramipril. And you know that in the pharmacology, this because this angiotensin-converting enzyme is responsible for the breakdown of bradykinin, so that in case of the patient taking AC inhibitors, this will inhibit the breakdown of the bradykinin and lead to the accumulation of bradykinin in the lung, and this accumulation of bradykinin will be responsible for the dry cough. طيب. And this is the reason why we develop angiotensin II receptor antagonists, because angiotensin receptor 2 antagonists such as losartan and valsartan, they can antagonize and the effect of angiotensin II in its receptor and does not affecting the level of the enzyme اللي هو angiotensin converting enzyme, so that they will not affect the breakdown of bradykinin, so that these are less prone to produce this type of dry cough. Angiotensin II receptor antagonists, which have similar properties to AC inhibitors, and which don't affect the bradykinin, can can be used as alternative preparation in cough if the cough is a problem is a problem and the patient is requiring this drug. Also, we have a time scale, treatment time scale. This is depending on the length of the time the patient he has had the cough, and once the pharmacist has recommended appropriate treatment for the cough, patient should see their doctor 2 weeks after the cough treatment started if it has not improved. هتديه مدة بتاعت أسبوعين، بعد تديه الكف ثيرابي أو كف ريميديز لمدة أسبوعين. إذا ما السيمتومز حصل لها improvement طوالي هو directly you should advise him to revert to their physician. Now we'll talk about the drugs أو the treatment and management بتاع الكف. Productive coughs should not be treated with cough suppressant. This is because the result is pooling and retention of mucus in the lungs and a high chance of infection, especially in chronic bronchitis. إذا البيشنت هو عنده productive cough, the patient is suffering from productive cough, you should not give him cough suppressant because many of these cough suppressants act directly at the cough center, medulla centrally, leading to the suppression of the cough, so that this will lead to retention of the mucus in the lung, and retention of this mucus increase the possibility of the infection, especially in case of chronic bronchitis. The demulcent like demulcents such as الهوني والجليسرين والبكتين, they are they have a soothing effect on the throat and particularly useful in the children and pregnant women as they contain no active ingredients. demulcent تلقى في كثير من الكف syrups هي عبارة عن demulcents، بالتالي هي فقط عندها soothing effect so that they are safe in case of pregnant women and in case of children. Now we'll talk about the cough suppressants. الcough suppressants اللي هم usually act centrally by suppressing the cough by direct inhibiting effect on the medulla, inhibiting the cough center. We have الكودايين والفولكودين والديكستروميثروفان. This is the three famous drugs that use as cough suppressant أو also هم بنسميهم الantitussive drugs. The folcodine has several advantages the folcodine have several advantages over codeine in that it produces fewer side effects compared with the codeine. Even at O2C doses, codeine can causes constipation, and at high doses cause respiratory depressions. ودي هي الأوبيويدز. نحن we know these drugs are opioids, and opioids, one of their effects and the famous effects of opioids, they cause constipation because they decrease the GIT motility, leading to constipation. This is beside their main effects on the central nervous system في الميو والدلتا والكابا receptors. And الفولكودين is less liable to be abused مقارنة بالكوداين. But both of them can induce drowsiness, and this is one of the CNS effects of these drugs. Folcodine can be given at a dose of 5 mg to children over 2 years of age. Adults may take doses up to 15 mg 3 or 5 or 4 times daily. The drug has a longer half-life and may be more appropriately given as a twice daily dose. نتيجة لأنه هو عنده longer half-life time can be given twice daily. We have dextromethorphan اللي هو نحن بنختصره بالDM. Any cough syrup you find it in its name DM. This is referred to dextromethorphan, which is a synthetic opioid-like drug. Dextromethorphan is less potent than fulcodeine and codeine. It is generally non-sedating and has fewer side effects. Occasionally can produce drowsiness. Drowsiness had been reported, but for fulcodeine this does not seem to be a problem in practice. Dextromethorphan can be given in children of 2 years of age and more than that of 2 years old. Dextromethorphan was generally thought to have a lower potential for abuse. However, there have been rare reports of abuse. Dextromethorphan أقل من normal abuse، لكن the most اللي هو famous of abuse اللي هو الكوداين. الكوداين كان موجود عندنا في شراب بتاع قحة كف سيرب that called الactivate compound. الactivate compound this is with the red color. كان فيه هو كوداين، لكن نتيجة للابيوز بتاعه كان عنده ريبورتس عالية جدا بتاعت ابيوز، هو withdrawn من الماركت نتيجة للابيوز بتاعه. ولأن هي قلنا هي اوبيويد انالجيزيك، بالتالي ممكن كلها تعمل الادفيرس افكتس بتاعت الابيويدز especially in large doses. وانتوا عارفين الابيويدز اصلا الاكشن بتاعها بالذات في النيو ريسبتورز ان هي بتعمل ايوفوريا and this is the reason of why they are abused due to the euphoric effect بتاعها. We have this is الاميلين دي ام امي فارما برودكت اللي هو دي ام فيه ديكستروميثورفان و سيدوفان دي ام فيه اللي هو ديكستروميثورفان اللي هو الانتيتاسيف. We have also Unifed DM اللي هو that contain اللي هو dextromethorphan. This is cough syrup not available here in our local market اللي هو fuel fulcodeine for dry cough اللي هو antitussive. Now we'll talk about the expectorants. Expectorants those drugs that used for expectoration اللي هو الريموفال بتاع السبوتم. Expectorants we have two ingredients either ammonium chloride or guaifenesin. This is the two اللي هو expectorants materials or drugs. There are two mechanisms that have been proposed for their action. The first mechanism is that they act directly by stimulating bronchial mucus secretion, leading to increased liquefying of the sputum, making it easier to be coughed out or coughed up. An alternative mechanism that they act indirectly via irritation of the gastrointestinal tract, which has a subsequent action on the respiratory system, resulting in increased mucus secretion. These are two mechanisms that proposed for their for the action of mechanism of action of expectorants. The dose of guaifenesin required to produce expectoration is 100 to 200 milligram. Because expectorants increase the volume and reduce the viscosity of the tenacious sputum, the patient thus instructed to take larger amount of water, especially إن هم البيشنت عندهم reproductive اللي هو productive cough. To facilitate the action of an expectorant, you should advise this patient to increase the fluid intake بتاعه. We have الإيزيلين expectorant، الهيستاليكس كاف سيرب هو برضه expectorant، هو فيه تو اللي هو فيه بيتيادا فيه البيتيادريك. This red color for pediatric and for adult. This is another formulation for adult. The ammonium salts اللي هي عندها برضه قلنا هي expectorant effect are irritant to the gastric mucosa. They can produce nausea, vomiting, acidosis, and hypokalemia. But because we use them in small doses, they less prone to produce these adverse effects. We have demulsants وقلنا هم عبارة عن inert اللي هم inactive ingredients, they just producing soothing effect. preparations such as glycerin, lemon and honey or اللي هو simple linctus are popular remedies and are useful for their soothing effect. They don't contain any active ingredient and are considered to be safe in children and in pregnant women. Their pleasant taste makes them particularly suitable for children, but their high syrup content should be noted, especially in diabetic patients, because we know that most of the cough syrup, and from the pharmaceutics, the dosage form syrups usually contains higher sugars content, or so that should be noted in case of diabetic patients. This is a formulation containing demulcents in their preparations. Now we'll talk about the other constituents that occur في اللي هي الكاف syrups أو الكاف remedies. We find also antihistamines. Example for the OTC product اللي هو الانتيستامين that occur في ال OTC cough products include الدايفينهيدرامين والكلورفينيرامين and الترايبروليدين and البروميثازين. A combination of an antihistamine and cough suppressant may be useful in that antihistamines can help to dry up the secretions, and when the combination is given as a nighttime dose, if the cough is disrupting sleep. We talked already about this in the previous lecture. Because الانتيهستامين قلنا عندها انتي ماسكارينيك وبالتالي انتي ماسكارينيك can dry a secretion, and this will help اللي هو and also we mentioned that they because sedating, and this also will help to avoid the disrupting sleep. The combination of antihistamines with expectorants are illogical and best avoided. يبقى الانتيهستامين لان هي بتعمل دراينس سكريشن وبتعمل عندها افكت في اللي هو في سبريسنج افكت في الكف، فبالتالي فقط should be اللي هي combined with الكف suppressant لكن should be avoided in case of expectorant in case of الكف البرودكتيف كف، لانها هي كونها تعمل لي دراينس او تعمل لي درايلس سكريشن this not desired في in case في البيشن عندهم برودكتيف كف. بالعكس احنا في البيشن عندهم برودكتيف كف قلنا احنا increase الفلويد intake in order to enhance الليكويفيكيشن بتاع السبوتم. فبالتالي الكومباينيشنز بتاع الانتيهستامين with expectorants are illogical and should be best avoided. The non-sedating antihistamines, the first generation antihistamine, are less effective in symptomatic treatment of coughs and colds because of their less pronounced anticholinergic actions. While the traditional antihistamines, اللي هي first generation antihistamine، non-sedating طبعا هي second generation، والtraditional antihistamine هي مقصود بها first generation antihistamine أو sedating بنقول عليها sedating antihistamine should be used by the patients who are taking should not be used by the patient taking phenothiazines and tricyclic antidepressant because of the additive anticholinergic and sedative effects. اتكلمنا برضو we already mentioned this in the previous lectures. Increased sedation will also occur with any drug that has CNS depressing effects such as alcohol, البنزوديازيبين واللي هو الفينوثيازين والباربيتوريتس والبيوتيريفينونز كلها should be avoided نتيجة لأنها هي can increase sedation. Now we have sympathomimetics. Also we find the sympathomimetics في اللي هو في الكف preparation. We have pseudoephedrine. It is most commonly used oral decongestants included in the cough and cough remedies for its bronchodilatory and decongestant action, because here sympathomimetics also can act on البيتا receptors في البرونكيولز leading to bronchodilation, and this is a desired effect. It may be useful in the patient that has blocked nose, and as we talked previously, as well as the cough, and expectorant decongestant combination can be useful in productive cough, so that sympathomimetic also sympathomimetic drugs also combined with اللي هو combined with expectorant drugs. Sympathomatics can cause raised blood pressure, stimulation of the heart, and alterations in diabetic control, as we talked in the previous section. So that an oral sympathomimetic should be used with caution in patients with diabetes, coronary heart disease, such as angina, hypertension, and hyperthyroidism. Steam inhalations. This can be useful particularly in productive cough. هو حقيقة يعني يمكن ما عندنا في الهوسبيتال بتاعتنا هنا، لكن في other countries دائما البيشنت لما يجي suffering from respiratory system بيدوه steam inhalation. This steam helps to liquefy lung secretions, and patients find the warm moist air comforting. هي بيدي هو كان minorly or كان اللي هو facilitating the relieving بتاع symptoms. Some may prefer to add the preparation such as the menthol and the eucalyptus واللي هي volatile oil that can give a soothing effects اللي هو بيعمل لهم إضافة مع الستيم inhalation. ويمكن traditionally حتى دائما بينصحوا الناس اللي عندهم كف أو عندهم كول أو عندهم symptoms بتاعت كول بدي ياخدوا ستيم اللي هو inhalation، وبينصحهم دائما بياخدوا الحياة الدافئة، لأنه الستيم ده بتاعهم ده هو كان warm كان moist اللي هو وكان liquefy secretions بتاعت اللنج. The fluid intake. Maintaining a high fluid intake helps to hydrate the lungs, and the hot drinks can have a soothing effects. General advice to patients with coughs and colds should be to increase the fluid intake in about 2 liters per day. And that is all about this symptom, the cough, respiratory symptom cough. Now we have case 1. We have 2 cases. Case 1, we have Mrs. Patel, the woman in her early 20s, asked what you can recommend for her son's cough. On questioning, you find out that her son, who is named Dilip, age 4 years old, has had a cough اللي هو on and off for a few weeks. On and off cough for a few weeks. He gets it at night and it is disrupting his sleep, although he doesn't seem to be troubled during the day. هي فقط nocturnal. She took Dilip to the doctor about 3 weeks ago, and the doctor explained that antibiotics were not needed and that the cough would get better by itself. The cough is not productive, and she has given Dilip some Tixilip اللي هو Tixilix, this is a cough syrup, before he goes to bed, but the cough is not better. Dilip is not taking any other medicines. He has no pain or on breathing or shortness of breath. He has had a cold recently. Can him to cold recently. The questions first: is Dilip a candidate for referral? If you come back to this case, do you think this Dilip, the 4 years old, a candidate for referral or not? Actually, the true answer is that Dilip is a candidate for referral. Why? because the cough is persistent for more than 2 weeks, and although he tried the cough syrup, there is no improvement. So that DLIP should be اللي هو referred for more investigation. What is your recommendation and advice? And already I answered this. Recommendation is to refer this child for the physician for more investigation, because this child may need further investigation to avoid that this child is going to develop asthma or no, or any other symptoms. This is it's better to refer this child for the physician for more investigation. Let us take case 2 as homework. You should answer this case and give me a feedback, inshallah ta'ala. That is all. Thank you for listening.